If I've known what I know now, Don Harris, my father-in-law, might have had a different ending. Don, this one's for you, and for every family watching who's felt that slow, relentless fade of someone they love. Today, I'm handing you a practical, science-anchored plan to lower dementia risk and support brain function, what some call type 3 diabetes. Stay with me till the end, because I'm going to give caregivers the resources I wish we'd had on day one. And I'll expose a couple of brain supplement gimmicks that don't live up to the hype. Here's the big idea in one sentence. The brain struggles when it can't use fuel efficiently. When insulin and glucose stay high, inflammation simmers, and mitochondria underdeliver. That's why so many people with cognitive decline have glucose hypometabolism in the brain, and why ketones can be a literal plan B for fuel. Think of ketones as premium, clean burning gas for neurons. So our strategy starts where your cells eat, your plate. What would I do differently now? I'd build everything on metabolic health. In clinic, I offer 3 on-ramps: low-carb, ketogenic, or carnivore, chosen by preference, labs, and lifestyle. The mechanism is elegant and practical. Lowering carbs drops insulin, quiets oxidative stress and glycation, and reduces the metabolic traffic jam that injures neurons. Meanwhile, ketones bypass the brain's glucose bottleneck and deliver energy. Yes, there are human trials showing memory benefits in people with mild cognitive impairment, and additionally studies where ketogenic strategies or MCT-based drinks improve quality of life or daily function in early disease. Here's the clinic version. Prioritize protein, especially ruminant meats, eggs, and seafood. Add non-starchy vegetables if you're keto, or go stricter if you do well on carnivore. Cook with beef tallow, lard, olive oil, avocado oil, coconut oil, butter, or ghee. Salt to taste, and keep carbs low enough to consistently make ketones. That's generally less than 20 to 30 total carbs per day. I have patients track fasting glucose, A1Cs, and when possible, fasting insulin, because insulin resistance is the villain behind the curtain. Let's talk MCT oil and omega-3s, because I know you'll ask. MCT oil, especially C8 and C10, is not a cure. It's a fuel assistant. It reliably raises ketones, and in trials has produced modest cognitive benefits in people with mild cognitive impairment or early Alzheimer's, often more so in those without the ApoE gene. I think of MCT as training wheels while you fix the foundation, your diet. Omega-3s, EPA, DHA, have mixed results alone, but the signal becomes stronger in mild cognitive impairment and when omega-3 status is good and homocysteine is addressed. Translation: don't just swallow fish oil and hope. Build the biochemistry that lets it work. Which brings me to a powerful underused lever, the homocysteine axis. Elevated homocysteine is linked with faster brain atrophy. In a well-known trial, supplementing B6, B12, and folate to lower homocysteine slowed brain shrinkage and cognitive decline in people with cognitive impairment. And the benefit was greatest when omega-3 status was adequate. My routine: measure homocysteine and aim for less than 10. Many feel best closer to 8. Check B12, folate, and methylmalonic acid, and ensure omega-3 sufficiency. This is root cause medicine. Fix the chemistry, then consider the pills. Supplements are the most confusing part of this space, so let me rank them by evidence strength, not marketing volume. Let's start with Tier A. This is the tier with the most supportive evidence in mild cognitive impairment and early decline. Number 1, B vitamins, B6, B12, folate, to lower homocysteine, especially when omega-3 status is good. This isn't a multivitamin pep talk. It's structural maintenance for your neurons. Number 2, omega-3s, EPA, DHA, particularly helpful in mild cognitive impairment and synergistic with B vitamins. Number 3, MCT oil, C8, C10, or ketogenic medical foods, adjunct ketone fuel. Benefits tend to fade when you stop, so treat it like a bridge, not the destination. Now let's go to Tier B. These are promising, context-dependent, and fix the deficiency first approaches. Number 4, vitamin D. Correct deficiency for global health, not a memory pill by itself. Number 5, magnesium L-threonate. Some small studies suggest improvements in sleep and subjective cognition. No hard dementia outcomes yet. If sleep improves, your brain may benefit indirectly. Number 6, cytokinin, CCD-choline. Encouraging signals in vascular cognitive impairment and post-stroke cognition, but inconsistent overall quality. Reasonable to trial case by case. Don't expect miracles. Now let's go to tier C. Marketed hard, weak evidence for dementia. Number 7, Prevagen. It was legally barred for claiming memory improvements after the state and FTC cases. Enough said. Number 8, brain blends like Neuriva. They basically did a short 42-day study in healthy adults with self-reported memory complaints. This really isn't dementia prevention or treatment. If a product's strongest claim is, I felt better in 6 weeks, keep your wallet in ketosis. Remember, pills are passengers. Food drives the bus. Now, beyond the plate, here are the lifestyle levers that generally move risk. Exercise is medicine. Resistance training for 2 to 3 days a week plus brisk walks most days improves insulin sensitivity, blood flow, and brain-derived factors. This is less about sculpting biceps and more about sculpting synapses. If you're deconditioned, start with 10-minute walks after meals, then add bands or bodyweight squats and a farmer's carry with grocery bags. Progress, not perfection. Next is sleep, because sleep is brainwash, literally. Your brain uses sleep to flush metabolic waste. If your spouse says you stop breathing or you crash after lunch, screen for sleep apnea. Treating sleep apnea improves attention and memory in many people, and ongoing trials are testing its impact on cognitive decline. Aim for 7 to 9 hours. Protect your circadian rhythm and give your brain the nightly rinse it deserves. What about hearing and vision? Please don't skip this. Treating hearing loss in higher risk older adults cut cognitive decline nearly in half over 3 years in a randomized trial. Vision matters too. Uncorrected problems are now on the risk list, so make sure you're hearing and keep those glasses current. The brain can't process what it can't perceive. What about your vascular and metabolic vitals? Tame blood pressure, glucose, and make sure your LDL particles are in the right range. A landmark recent study found that people with lower small dense LDL levels had a 38% lower Alzheimer's risk, even when the total LDL particles seem high. Studies using apolipoprotein B and small dense LDL panels are now showing us that particle numbers and density matters, because small, dense particles seem better at penetrating blood vessels, oxidizing, and triggering inflammation, especially in brain microvasculature. And when it comes to diet, a low-carb diet improves the LDL particle picture. So if you're insulin resistant, diet is your main lever, not medication. Now let's talk about connection and purpose. Loneliness injures the brain. Build your circle. Faith, family, friends, service. Eat together, move together, laugh together. I call it protecting your nest. Nutrition, exercise, less stress, more sleep. Protecting your thoughts, being in a community, having a purpose. Rope in some accountability, a walking partner, a lifter buddy, a church group. So after all of this, let's get painfully practical. What should you do this week? Pick your on-ramp, low carb, keto, or carnivore, and commit to 2 weeks. Track fasting glucose and, if you can, insulin and homocysteine levels. Add 1 to 2 tablespoons of MCT across the day if you tolerate it. Consider an EPA DHA supplement and recheck labs in 8 to 12 weeks. Get moving after meals. Lift something heavy 2 to 3 times weekly. And schedule a sleep apnea screen if you snore. Wake unrefreshed or have resistant hypertension. Book hearing and vision checks. And pick one social commitment that nourishes you. Call the friend. Join the group. Show up for the neighbor. And for those caregivers out there, I see you. You are the nervous system of the household. You will be stretched, and sometimes you'll snap. That doesn't make you weak. It makes you human. For tactical, compassionate help, check out CareBlazers on YouTube. Short, practical videos from a geropsychologist who understands the day-to-day dementia care. For Metabolic Brain resources and a big picture understanding of how metabolism shapes mental health, visit metabolicmind.org. They've curated training, podcasts, and tools to help families and clinicians apply metabolic strategies safely and efficiently. A quick shout out to Jane Ellison Bazuki and David Bazuki for elevating metabolic health worldwide. And I'm honored to serve as an expert within their Coalition for Metabolic Health. Their commitment is helping more families hear this message sooner, not later. Here are some books to deepen your understanding. Dr. Georgia E's Change Your Diet, Change Your Mind will walk you through how foods affect brain chemistry. And Dr. Chris Palmer's Brain Energy connects the dots between metabolism and mental health. These are great companions for the journey you're starting today. Let me close the loop with Don. If I could rewind time, I'd start with a metabolic reset. Low-carb or ketogenic nutrition, earlier lab monitoring, ketone support with MCT if needed, omega-3 sufficiency, and aggressive attention to sleep and hearing. I'd push for homocysteine testing sooner and B, vitamin repletion if the homocysteine is elevated. And I'd build a caregiver plan with real-world support from day one, instead of waiting until crisis mode. I can't rewrite Don's story, but I can help you write yours. So if this video helped, tap like so YouTube shows it to more families. In the comments, tell me where you're watching from and the one step you'll start this week. Subscribe if you want more Metabolic Brain content. And at the end screen, watch my Father's Day video, 10 early signs of dementia we all should know. It pairs perfectly with this plan. And a friendly note, this is education, not personal medical advice. Talk with your clinician before changing medications, diet, or supplements, especially if you're on glucose lowering or blood pressure meds. We want safer, steadier brains, not surprise hypotension on the way to the bathroom at 2 a.m. You'll find links in the description for the CareBlazers and Metabolic Mind YouTube channels. And remember, prevention isn't a promise, but it is power. And power used daily changes trajectories. For Don, for your loved ones, and for you.